Hello and welcome to this educational series called Welcome to Medicare. This program is presented by the Wisconsin Department of Health Services, which operates the Wisconsin State Health Insurance Assistance Program, or SHIP, a local public service for people with Medicare. Every state has a SHIP program. In Wisconsin, you can get free and unbiased help with Medicare from local SHIP counselors. You can download the slides to this presentation by clicking the link in the YouTube video description. This project is supported by a grant from the Federal Administration for Community Living. This program will provide an overview of Medicare and is divided into 6 parts. You can find this information in greater detail in your Medicare and You handbook, which is mailed to people with Medicare and can also be found on the Medicare.gov website. For easier understanding, you are encouraged to view the parts of this series in order. Welcome to part 2 of this series. In the last section, we talked about how and when to enroll in Medicare. Now let's go over some Medicare basics. This chart provides a brief summary of what each part of Medicare covers. Part A helps cover inpatient care in hospitals and skilled nursing facilities, as well as hospice, home health care, and blood that you may receive as an inpatient. Part B helps cover doctor's services, outpatient care, home health care, and many preventive services. Part A and Part B are considered Original Medicare. Medicare Advantage plans, also known as Part C, are an alternative to Original Medicare. They are managed by private insurance companies that are under contract with Medicare. These plans include Part A and B and usually Part D. Part D helps cover the cost of prescription drugs. These plans are run by private insurance companies that follow the rules set by Medicare. Let's take a closer look at the Part A benefits. Part A helps cover the cost of inpatient hospital care, a semi-private room, meals, general nursing, other hospital services and supplies, includes inpatient rehabilitation facilities and inpatient mental health care in a psychiatric hospital, inpatient skilled nursing facility care after a related 3-day inpatient hospital stay. It also covers blood you may receive as an inpatient, home health care, and hospice care. It does not cover private duty nursing, private room, television or phone if the hospital charges separately for that, personal care items like razors or slipper socks, or custodial care, which is non-skilled care in a nursing home. Most people do not pay a premium for Part A. People who have paid taxes to Social Security for fewer than 10 years may need to pay a premium. There is a deductible for Part A. For 2026, the deductible is $1,736. The deductible is based on benefit periods, which last 60 days. A benefit period begins the day you're admitted to a hospital or skilled nursing facility as an inpatient. The benefit period ends when you haven't received any inpatient hospital or skilled nursing facility care for 60 days in a row. If you go into a hospital or a skilled nursing facility after one benefit period has ended, a new benefit period begins. You must pay the Part A inpatient hospital deductible for each benefit period. Benefit periods can span across calendar years. You may also need to pay a set amount of money per day or a copay when you are an inpatient in a hospital or skilled nursing facility. No copayment is required for home health care or hospice care, but you must meet certain requirements to get home health care or hospice covered. There is no out-of-pocket maximum with Original Medicare. We'll talk about Medicare Supplement Insurance or Medigap and how it can help with these costs in the next section. Please note that costs change every year. To see current costs under Part A hospital insurance, please visit Medicare.gov. This chart shows the 2026 Part A costs related to an inpatient hospital stay. For the first 60 days in a hospital, the patient must pay the Part A deductible of $1,736, Medicare pays the remainder of the covered costs. Days 61 to 90, the patient must pay a set amount per day called a copay. The patient is responsible for $434 a day, and Medicare pays the remainder. Days 91 to 150, the patient pays a set higher copay per day cost. The patient is responsible for $838 a day, and Medicare pays the remainder. After an inpatient hospital stay that lasts for at least 3 days, Medicare Part A may cover a stay at a skilled nursing facility. These are the 2026 costs for Part A related to stay in a skilled nursing facility. For the first 20 days after the inpatient hospitalization deductible is met, Medicare pays all the covered costs. Days 21 to 100, you pay a set amount per day, or a daily copay, which is $217, and Medicare pays the remainder. Medicare does not cover any costs after day 100. Your hospital status is a complex medical decision based on your doctor's judgment and your need for medically necessary hospital care. You are an inpatient if you are formally admitted to the hospital with a doctor's order. If the doctor has not written an order to admit you, you are an outpatient. An emergency room visit is considered outpatient. If you are in the hospital for an observation status, you are an outpatient, even if you spend the night. Medicare Part A pays nothing. Part B pays for doctor services and hospital outpatient services after you pay your deductibles, coinsurance, and copays. For drugs received during an observation stay, you'll likely need to pay out of pocket and submit a claim form to your drug plan for reimbursement. You can request an out-of-network pharmacy claim form from your Part D plan. If you are in the hospital more than a few hours, ask your doctor or hospital staff about your status. Hospitals are required to provide you a notice about your status if your observation stay is longer than 24 hours. Now let's talk about Medicare Part B. Part B helps cover medically necessary outpatient services and supplies including doctor services, outpatient medical and surgical services and supplies, clinical lab tests, durable medical equipment, diabetic testing supplies, preventive services, and home health care. To have Medicare Part B medical insurance, you need to pay a premium every month. The monthly premium changes each year. For 2026, the monthly premium is $202.90. People with Medicare who have higher incomes pay higher Medicare Part B monthly premiums. These income-related monthly premium rates are called the Income-Related Monthly Adjustment Amount, or IRMA, and affect about 5% of people with Medicare. Social Security uses your IRS records from 2 years ago to determine if you need to pay a higher Part B premium. The Part B premium may be deducted from your monthly Social Security check. If your Part B premium is not deducted from your check, Medicare may bill you. Medicare Easy Pay allows people to have their Medicare premium payments automatically deducted from a savings or checking account each month. There is an annual deductible for Part B. For 2026, the annual deductible is $283. For most covered services, like doctor services and some preventive services, Medicare will pay 80% of these costs, and you pay the coinsurance, which is the remaining 20%. As long as the provider accepts Medicare assignment, that means that the provider accepts what Medicare pays as a payment in full. If the provider doesn't accept assignment, they can charge you another 15%. Many Medicare preventive services are covered in full and do not require any out-of-pocket payments. People with Medicare who have higher incomes pay higher Medicare Part B monthly premiums. These income-related monthly premium rates are called the Income-Related Monthly Adjustment Amount, or IRMA, and affect about 5% of people with Medicare. This chart shows the Part B premiums for people with higher income. The amount is based on your tax return from 2 years earlier. To see the amount you would pay for your Part B premium, look at your tax return from 2024 and compare it to the chart on your screen. Medicare Part B covers 2 preventive visits, a Welcome to Medicare visit and a yearly wellness visit, as well as a range of additional screenings and services intended to help prevent illness and detect medical problems early when treatment works best. A description of these preventive services can be found in your Medicare and You handbook. You are encouraged to review these services and talk with your doctor about your individual prevention plan. Your Welcome to Medicare visit is covered during the first 12 months that you have Part B. It's important to note that this is not a physical. This visit includes the items listed here, as well as a review of your medical and social history related to your health. When you make your appointment, let the doctor's office know that you'd like to schedule your Welcome to Medicare preventive visit. The visit is covered by Medicare, including the deductible and copayment. However, if you receive additional tests or services, you may have to pay coinsurance and the Part B deductible may apply. Once you've had Part B for longer than 12 months, Medicare will cover a yearly wellness visit. The main focus of this visit is to create and update a prevention plan based on your current health and risk factors. You will be asked to complete a health risk assessment to help your provider create a personalized prevention plan. The visit is covered by Medicare once every 12 months at no charge, including the deductible and copayment. However, if you receive additional tests or services, you may have to pay coinsurance and the Part B deductible may apply. You should ask for the yearly wellness visit by name. Also, the yearly wellness visit is not a physical. Medicare does not cover a physical. If you schedule a physical, you may need to pay the full cost for the physical. Medicare Part B covers 2 preventive visits, a Welcome to Medicare visit and a yearly wellness visit, as well as a range of additional screenings and services, intended to help prevent illness and detect medical problems early when treatment works best. The Part B deductible and coinsurance are waived for most preventive care services. This chart is a partial list of preventive benefits. More information on preventive services can be found in your Medicare and You handbook. You are encouraged to review these services and talk with your doctor about individual prevention plan. This concludes Part 2 of the Welcome to Medicare series. I hope this information has been helpful. The next section in this series will discuss your coverage choices, original Medicare, and Medigap insurance. This presentation was brought to you by the Wisconsin State Health Insurance Assistance Program, or SHIP, a local public service that provides free and unbiased help to people with Medicare. If you have questions about Medicare, you can call the Medigap helpline at 1-800-242-1060 or visit the Wisconsin Department of Health Services website to find a local SHIP counselor near you.